July. Big things are underfoot in July next year. We'll have local health networks, which will have, and Queensland Health have alluded, and I think it won't alter, we'll have a hospital flavour, an acute care flavour, but we'll also maintain its community services until, we're hearing at this stage, 2016. Our own standards, we are going to actually ask you to send us your information. We're very, very proud of you. 227 facilities have been reporting to us regularly. Now that's not happening in any other state, and we've tried to work with the Commission, and our sense is that Queensland is ahead of the pack. Queensland has done extremely well. You're the ones that have done well, not us, although I'm extremely proud of our staff. Yes, we've got the standards up. We want to see that round, at least one round. It's all the way to September to give you a year. We rethought it at the 6-month block. We don't want you to stop your audits. We want you to keep going. The reason we're doing this is because there's too much happening in between times, where particularly for public facilities you are going to move and reorganise yourself and have different governing bodies. It is unfair in the middle of that to say, look, why are you doing that? We just send us some information related to all of this. So we're going to give you a bit of a breather, but keep auditing, keep collecting the information, keep talking with us about the difficulty. In the background, we will align to the national standards. We will also keep, as we do, very, very close relationships with accrediting agencies. We are monitoring both the individual practitioners and the hospitals, the complaints that we get in against those standards. Not surprisingly, we've found some anomalies related to credentialing, where some of you may report that you're doing really well from a compliance perspective, but then in walks some complaints which turn into investigations, which tell us that in reality this mightn't be happening, that credentialing is not really at the standard that we expect. So then we would go out and ask you for more information. So that's where we triangulate and verify, we get out in the field, we ask some of you to send more information, and if it's not right, we take action. And it's just a responsive regulation model that we've often shown, and for us that's the space we're in. Most of the time we want to get to very few people we should be reporting through Parliament. Most people we should be dealing with are complying. If you're showing that you're not complying, we get in early and work with you to try and improve. This is adapting the Australian Commission's, I'm going to show Chris Bagley's original slide, but I'm just taking this, we're saying, okay, you've got regulators, you've got the Australian Commission on the right there, you've got health services, your own group, and in public system we're going to have local hospital networks, and you've got accrediting agencies, of which ACHS is one. Okay, I'm going to give you a little bit, I only asked Chris for 3 slides, and I'm just going to go through these. The first one is extremely busy, and you please forgive us, but I thought it was a really good one to share. Don't have to read it, I'm just going to take you through. In the middle is the Commission, and here they are in 2006. This is the Australian Commission. Around it are all the standards that they want to get themselves involved in. Okay, so if you count them up you can see what they are. Then they've gone out and said what they've done in those spaces, and the further out you go there are tools, and they're telling us about timelines, when it's been to RMAC, who's okayed it, etc. Okay, this is the other one that I adapted, you saw one earlier. But the interesting thing is to say that all the health ministers from all jurisdictions, so all states and territories, have got together and they've said big tick to this. And that is, if you go to the far right hand side, and you'll see that the Australian Commission was to develop and maintain the standards. They were to advise the Ministers' Council, so the Ministers' Council will sit above the Australian Commission on accreditation. And they'll approve the agencies, so they'll give a tick to places like ACHS, ISO, etc. They'll approve those agencies, they'll receive the relevant accreditation data, and that's the stuff that's worrying, even for the Commission. They'll liaise with regulators, so they're your state and territory players. In our state, Queensland Health at this stage. And they'll report to the health ministers.